I'll call this meeting to order. It's 1:05. CRT Wheelchair Repair Advisory Council. Thank you all for being here. And this is a new chapter for us. We're under the hospitality of OHA, and we'll hear a little bit more about that. But just thank you so much for taking us on, and we look forward to working with you. I have really positive feeling about this council moving forward. I think we're going to do a lot of work, and I expect that we're going to be more collaborative and just keep going in a positive direction. So really happy about where we're at and where we're going. So, and I'll turn over my co-chair if you have anything.
Thanks, Maureen. I just want to echo what you said. Happy to be working with Becky and Alexandra and OHA and New Start. Good to see some fresh faces and new voices as well. So looking forward to all of that.
Hi, John.
Hello.
Okay, so just a couple of housekeeping. Well, first of all, I do want to address the time change. I really apologize for that. It was just something that it was so out of our control. We had so many moving parts with this transition that some of them were a little unexpected, and it just had to happen. And it's always our goal to involve the whole council with any decisions, any meeting time changes, but this was just something that it was just very last minute, and we just wanted to make sure that we could have as many people present as possible.
Maureen, I'll invite you to jump in. I'll listen to everyone. Full disclosure, I will take the hit on this. I had to be at school this morning. In fact, Sheldon was there as well, and I just didn't want. I knew I couldn't make our normal time, and was questioning whether or not I could even make this time. But fortunately, the meeting ended in plenty of time for me to make this time. So today was totally on me.
Yeah. Well, yeah, and sometimes we do have to make a decision on behalf of the council, and but we always have everyone's interests at heart. So just want to clarify that. As far as appointment letters, the advocates and Sheldon, I know you have your appointment letter, and the industry, we don't have Diane here. Has everyone received their appointment letters? I know the new people have, but Gary, is Joe on here?
I have not, but would it come in the mail or?
It should come email, and I'm not even sure because there are two different. It's the ranking members of either the general law or the human services committee. So, and one of them is going to point each of you, and so yeah.
I'll check my spam filter because
it probably wouldn't be your spam. It's been we just got a last minute one right before the meeting, so it's just I guess and Becky has said that or anyone in the state agencies, they say that these they sometimes are slow to come, so it's not a big deal. But if you do receive it, make sure that Becky and Alexandra receive it too, and probably send it to John and me as well.
Okay.
Yeah. Okay.
Sheldon has his hand. Sheldon has his hand raised.
Thank you. So I don't know how to. Oh, I see it now. It doesn't bump them up to. Okay, it doesn't bump you guys up to the scale. Okay, like Zoom does. Sorry, Sheldon. Go ahead.
Thanks. I just wanted to correct something. I have not received an appointment letter, as far as I can tell. I think the one I got 2 years ago was from Senator Lesser. So, and of course, my spot will differ from others because specifically, the statute says specifically the protection and advocacy or disability rights group. So that's my organization. So it would have to be either me or somebody in my organization, I'd be the one. So I don't think there's any question about it, but I just wanted to clear that I haven't gotten a letter yet.
And I should have clarified, but I see Becky's hand up, so I'll let you clarify, Becky. Go ahead.
Yes, Sheldon, I just wanted to let you know, we did get confirmation on your, we did get a letter from, Maryann actually sent it to us this week. So we do have confirmation that you were appointed again to the council. And we can forward that to you as well, or I'm sure Representative Gilchrist's office will have it as well. So.
Okay, thanks for all that support.
Maybe forward to Todd and Suzanne as well, because they haven't received theirs.
Yes,
if you don't mind.
We can absolutely do that.
Great, thank you. Okay, and so now because we have a new, some new people on, and especially a new admin, we do want to just kind of go back being a little bit more formal, and just especially with the raise hand function, it helps. It will help Alexandra, and it will also help all of us in the new people. Suzanne, your camera's on. Yeah, that's great.
Where is the raise function?
Yeah, so raise your hand, and it's also because when we're having a conversation, and if someone's a little trying to get their word in, or they have their hand up and other people are jumping the line, it's not really respectful. So we just want to go back to that. And this is also kind of directed to Diane, because she does take over sometimes with calling on people. And we're just going to field all the questions through the co-chairs for at least the time being. And also we're going to ask that cameras be on. And that's, again, just a respect thing. And I understand when you're working, there may be a reason that you have to have your camera off. And when you have a disability, there's a reason you have to have your camera off. We're all adults. I'm going to trust your discretion, but we are going to ask if you are able to have your camera on, to have it on. And I think that is it. So we're going to, I'll go around with introductions. I think we'll start with the co-chairs, and then we'll go to Alex. So just welcome everyone, and I'll keep it brief because everyone does know me. I'm Maureen Amirault. I am the co-chair, and I represent Citizens Coalition for Equal Access. I'm a wheelchair user and customer of New Motion. Go ahead, John.
Hey everyone, I'm John Slifika. I'm with the Department of Aging and Disability Services in the Commissioner's Office. I'm co-chair. Also a wheelchair wheelchair user that uses New Motion as well. Know so many of you for many years, but again, happy to see some new faces here. Thanks, Maureen.
Thank you. And Alex, we're so happy to have you. Welcome.
Thank you. Hi, everybody. I'm happy to be here. Good to see everybody. I am Alexandra Lowry, but please feel free to call me Alex. I am the administrative assistant for the Office of the Healthcare Advocate, and I'm going to do my best to support the admin needs of this group.
Thank you. All right, Becky, go ahead.
Hi, good afternoon, everybody. I'm Becky Jacobs. I'm a staff attorney with the Office of Healthcare Advocates, and we're excited to have you all under our branch for administrative purposes, and we're here to make it as easily accessible as needed and get to you as much information as we can on a timely basis. And I'm really excited to have Alex as part of our group now. And I'm also the one that if there's ever a complaint, if anyone's consumers are sending in complaints, I'm the one that handles them within our agency. So if anyone has questions or any concerns about that, they can contact me directly about that as well.
Thank you. Okay, Todd, go ahead. Muted.
Very good.
Oh, it just went back to mute. There you go.
Hello? Okay. Todd Johnston. I'm 66, well, this year, 66 years old. I'm a paraplegic. I've been in a wheelchair for 43 years. Started with a manual chair, now I'm in a power chair. I've been an advocate for most of my time, having the disability. I work at the North Central Area Agency on Aging as a choices counselor, and I'm on the board of directors for the Spinal Cord Injury Association of Connecticut as the VP of Advocacy. Thank you.
Okay, thank you. Gary.
Good afternoon, everybody. My name is Gary Gilberti. I've been in the CRT industry for 40 years, 35 of those years as an ATP owner, and now Executive Vice President for the Eastern United States for New Motion. I've been in this role since New Motion was formed in 2013. And I've been as long an advocate and worked on Capitol Hill and state legislatures advocating for access to enabling technologies. And I'm here to try and help us as New Motion be better every day and to help you all get better access to repairs and equipment.
Okay, thank you. Sheldon.
Hi, everybody. I'm Sheldon Taubman, litigation attorney at Disability Rights Connecticut, which is the state's nonprofit organization that serves people with a full range of disabilities, all kinds of things. And this has been an area that came to our attention because specifically, complaints of individuals who are having access issues. I guess that was 3 years ago, 3.5 years ago, whatever. And I've been working on it since, and I've been on the various. So this is the council. Before that, there was the task force, and before that, there was an informal work group meeting with the industry. So there's been permutations on this, but I am, and I think others would probably agree. Don't speak for them, but I suspect they would. That we are proud of the fact that Connecticut is still the only state that has passed a law that has an actual requirement of timeliness with a specific number of days in the country. Thank you.
Thank you. Jenny.
Good afternoon. My name is Jenny Mahoney. I'm with the Department of Social Services. I'm in the Division of Health Services, and I oversee durable medical equipment policy. And this issue is also close to our heart. We want to make sure that members receive timely repairs, but we also work with the industries and making sure that they can also try to provide these services to our members. Thank you.
Thank you. Suzanne.
Hi, I'm Suzanne Garraffa. I am with the Citizen Coalition for Equal Access, the Wheelchair Coalition, and ADAPT. And I'm also Suzanne Fights for Change. And I'm representing on this council Medicaid.
Okay, thank you, Suzanne. And also just a note, Suzanne said it was okay to just close this. She does have some visual impairments, which is why we're having difficulty with the camera. Anyway, Suzanne will probably, when her aide is not available, she will be raising her hand in front of the camera. So if we can have extra set of eyes on Suzanne if she has a question, just so we don't miss it. Same as we did with Michelle using the chat function. All right, thank you, Suzanne. Maryann.
Thank you, Maureen.
Yep, thank you.
Hello, my name is Maryann Colón. I am a part-time wheelchair user. I am diagnosed with a stage 4 disability, and my cat wants to talk too. I am on the PCA Governor's Appointment, PCA Workforce. I'm on the Handicap Parking Council, and I'm just like really happy to be here. I am private pay. I purchased my own chair. I am employed. I have private insurance, and it's just a different world when you're navigating a system without benefits, but it can be done.
Thank you. Farah.
Hi, I am Sarah Garland. Sorry, my camera is off. I'm in transit due to the scheduling change. But I'm a annual chair with power assist, and I have national seating as my I guess company of choice, company assigned to me, company the insurance gave me. Here we are. I'm a community and political organizer, as well as an advocate, activist, and educator, and I am just really delighted to be here for a second go round. So, and I'm representing the State Independent Living Council as well as queering disability. So lovely to be here with you all.
Okay, thank you. Becky and I had talking offline, just mentioned, we've talked about how it's interesting to hear everyone's backgrounds. And so even though I know everyone, it's kind of good to get that, hearing those backgrounds again. And, we always, sometimes it would be great to just hear where, some of you have gotten into, this industry, or this kind of work, the kind of work that you do, like Jenny with DSS and Gary. Anyway, I'm going to hand this over now to Becky, and she's going to talk about the transition, and a little bit about the logistics with CTN, with YouTube, website, all of that, and where we stand, because I think we're still working on things. But go ahead, Becky.
Okay, thank you, Maureen. So this has been a transition, and we wanted to make sure that it was streamless. There have been a little bit of some hiccups along the way, only because of the fact that everything used to be posted on the committee, the
CGA, Human Services.
Yeah, right, exactly. So the Human Services Committee before, and that's no longer going to be happening, but the minutes are going to still be housed there from the prior meetings. From now on going forward, they're going to be on the Secretary of State site. Right now, they're listed under the Office of Healthcare Advocate, and you'll find them listed next to our Advisory Council meeting updates. But I'm working with the Secretary of State's office now to have a separate entity for the Wheelchair Repair Advisory Council. And so you'll be able to just sign in and look at the Wheelchair Repair Advisory Council, and the meeting minutes will be posted, the agendas will be posted. Alexander's been really great with getting those all put together. And the CTN has information and knowledge about all of our meetings. It is our goal to have all of the meetings at the set time, like we said, at 11 o'clock on the third Wednesday of every month. And the meetings have been scheduled and posted for the full year. So that's posted all for the full year. So we don't have to worry about, hopefully, our meetings changing, except for maybe, I guess, in December, like we all talked about when the reports are due and things like that. However, you'll be able to access the meeting minutes and the agendas, and you're also going to see on the agenda where you can sign into our meetings. That's going to be there as well, always. And also you're going to see where you can find our meeting minutes in case you forget. That's one of the things we were also trying to find out, how we can host our live meetings, maybe not in real time, but after the fact. And so one of the things that we were considering was whether or not the Wheelchair Repair Council is going to get its own YouTube channel, or if we can put a link up on the Secretary of State site that you can access this Teams meeting and you can watch it later on. It's very important, I know, for FOIA reasons, and also for the public to have access to these meetings and to be able to see it, and for the legislator, and for anybody, for all of us, to be able to go back and re-access the information that we're sharing here together, and to share with our colleagues and for other community groups as well. So that is one of our plans. And as we get more information, we'll definitely share that with the council. Alexander and I are working behind the scenes trying to get that all worked out. And I was having conversations with them this morning. So within the next few days, hopefully we'll have a definite plan of where all that's going to be lying and updated for you all to be able to access. So I guess that's all for the council. I wanted to thank Ginny for a moment. She actually sent me the information that she's posting in their newsletter about the council and about where you can file complaints. And Ginny, I didn't get a chance really. I owe you an email, but I wanted to thank you for adding that in there and for putting that in there. And I shared it with Maureen and with John, and we'll share it with the council too. But I just really, really wanted to thank you for the advocacy that you're doing behind the scenes as well. And and I think that's one thing that we really want to do going forward with the council. I know this is a big part for OHA especially, is we want to give people a chance to shine where they deserve to be, people be made aware and to have that capability of showing how you're doing extra and over and beyond what the call of duty, right? So I wanted to call you out. You're our first one this month. So Ginny, thank you so much for doing that. And I greatly appreciate it.
Oh, my pleasure. Thank you.
And as far as any updates for OHA for cases that have been submitted, for the last 2 months, there haven't been any cases at all that have come forward to OHA, which we were hoping is a good sign. I'd let you all know in the past that I've been working with Gary and Diane directly. And Gary, you're here today, so I can give you kudos. You've been really, really great, especially like I said, with that other case, the veteran case that we worked with together. You jumped in right away and, with no questions asked, you're right on my team. So I truly appreciate that as well. And I'm looking forward, I'm hoping that going forward now with everyone having like our timelines and keeping this concrete with our timelines, that everything, you were so great at sending in your data this month, and Diane was as well. And I know Alexander and I really appreciate that. And so we'll get that out timely too. We'll get the minutes out timely. We're hoping to get them out the Friday before every meeting, so that everyone has a chance to review and see that. If anyone has any questions or concerns, they can contact us directly. But going forward, I have only good high hopes for the future, and I hope everyone does as well. And like I said, if anyone has any concerns, please don't hesitate to reach out to us.
Thank you. Yeah, and
welcome
really,
everybody else.
go ahead.
I didn't get a chance to welcome everyone else to the new people, so thank you. I know many of you, and I'm welcome.
Sheldon has his hand raised.
Yeah, I see that. So it was really great having the data and all, everything together on the Friday before. That was really great. So I'm glad that we're back to that schedule. And thank you so much, Ginny. Do you have a copy of that, of your newsletter or the page?
She had actually asked me to share it with the council. It's my fault. I'm so sorry, Ginny.
Okay.
I'm behind the scenes. I'm timed here only because of the fact that we've been working on just trying to get the timeline of getting this meeting out. But yes. I have a copy, and we have no problem sending it forward for you, Ginny, if that's what you prefer.
Sure, it'd be great.
Are you gonna share it now, or you're just gonna email it to us?
Yeah, if it's all right, we'll email it later.
Okay, great. Okay, Sheldon.
Yeah, thanks for the report, Becky, and thanks to you and Alex and Ginny for all this behind the scenes stuff. I just wanted to clarify a couple things. One, it sounds like the repository, the ultimate posting location is the Secretary of State's website, right? That's
right.
So my question is whether, and one of these you may not have reason not to be able to answer the question, but for the public, they don't know what the Secretary of State is, and is on the Human Services. You said that your understanding is that website's going to be retained for the up until now, the minutes. Is there going to be some notice there that says for as of a certain date, as of July 1st, go to Secretary of State website for updates or for further information or the later meetings, or do we know if there's anything like that? And then the same thing for you guys is on your website. You already have stuff obviously about wheelchair repair. Is there going to be some, go over there for stuff about the Wheelchair Council?
I can't speak to the Human Services site, but I can speak to our site. We are working with our IT department to get some language on our site to say that the meeting minutes and everything like that are going to be on the Secretary of State site, and includes a link too, so they can just click on the link and go right to the site. That's our hope and our expectation. But that's a good question about the Human Services site. I don't know that they're going to be doing that. I can request some information on that and report back and see what they say, but I don't know how to answer that question at this time.
Oh, thanks. Yeah, if you could follow up, or somebody else could as well. I mean, it'd be a one-time thing, right? We just say for further updates, go there. And then my other question was about the recordings. I think most everyone would agree that having recordings of all the meetings publicly available is really important. And CTN is great, they're here today, but they're not because of conflicting schedules, especially during the session. Otherwise, they can't cover all the meetings, and then there's no recording at all. So that's why it's really important that there be a regular system, which we have with the YouTube through the Human Services Committee. And I don't understand the stuff technically well enough, but as long as there's a way of recording it, and for every meeting, and it's publicly available, I think that's the touchstone.
Well, these meetings are definitely recorded, and they always will be, and there'll be a transcript of the meetings, right? So we will have those accessible. And I understand what you're saying about having them posted. So that's why we're hoping, and we're going to see. We're not guaranteeing at this time that is an option to put a link up to be able to access the video, but we are investigating that. And once we know for sure, we'll know how to handle that. Otherwise, it may be where the council has to do something independently, whereas they're creating a YouTube site or something along those lines. And we've had those discussions to let the co-chairs know, and then they all can have discussions with y'all as a team and see what's going to make most sense for the council. However, if we can, we're definitely on board to trying to make that accessible for someone to be able to access the team's meeting on that link, if that's an option. So we are investigating that.
So it sounds like that may work, and if it doesn't work, then it will be, this council itself has to take on the responsibility somehow to YouTube or whatever.
And yes, and we did investigate that through FOIA too, and the Department of FOIA here in Connecticut, right? So we got some guidance from them as well. So we're getting guidance from all the different departments to make sure that we're doing everything properly and right, and we're complying with the statute and with everything that we need to do by the book, I guess. We're following everything by the book. And what we can do within our agency, which is allowable, and we can make it more accessible and easily, more readily available for the public. We're willing to do too at OHA as the administrative body of overseeing it, right, as the admin piece. And I know Kathy is readily willing to do that if that is an option that we can put on the Secretary of State site.
Great. Thank you very much, and thanks for all your work behind the scenes. Both of you and Alex, I really appreciate, I know it's a lot. I don't understand how to do this stuff, let alone the work of doing it, so we all appreciate it. Thank you.
And so we can, if we could talk about this after, because Gary does have to go, if we want to continue this discussion. And I just saw that Maryann wrote something in the chat about getting the link. So we can just come back to that after Gary gives his report, because he has to leave in about 10 minutes.
Well, actually, I just found out I'm good till 2. So if you
Oh,
want, go ahead and continue on.
all right.
I'm good. I'll be here. Thanks.
Okay, so does I do have questions on how we would, as a council, maintain a YouTube channel, and I don't know if this is premature to have a discussion, or maybe we just need to keep that in mind, that this is a possibility, and maybe like how we think that would work. I don't know how you guys feel, if you want to talk about it now, you want to just think about it. And then also Maryann just asked about getting a link to the meetings. If we do have a YouTube channel, she can put them up. And I think that's okay, unless anyone has an objection. I mean, I think we have the Wheelchair Coalition. We might want to post the meetings on the wheelchair. We haven't been, but we could. I don't think there's any reason to object to that.
The only thing I don't know as far as a FOIA issue, right? So I don't know what you can share and can't. I just don't know. So I guess that's something that you might want to investigate, and to see if that's something. I mean, obviously it's a public meeting, right? So anyone can watch it or see it. I just, I'm learning as we go along as well. About what is. So I don't know if maybe you all want to investigate that first before you make any decisions. Just my thoughts on that.
And maybe they'd be a good resource if the council has to take on that responsibility. We'd probably want to talk to them about it. Okay. And just checking the other page, scroll and making sure no one has any questions. Okay. All right, then, Gary, you're up.
Great, thank you. I'm proud to say that we are caught up on our reporting. We had some issues in May, and that report has been submitted, and also submitted the June report last week. We've done a lot of scrubbing of the data and going back. So there were some questions as to the validity of our data, and we've gone back and verified everything in our formulas because we've automated the process. The only thing, the difference is the last couple of months, as the one thing I mentioned in May was that we had lost 2 technicians, and that was unavoidable. We had to performance manage a couple technicians. One was doing something very non-compliant, and we wanted to make sure, we're doing everything as compliantly as possible. But we had to terminate 2 technicians. We have job openings posted for both those, and we expect to be back up to 8 technicians in, actual 100% service technicians in the state by probably the mid to end of August. In the meantime, we're trying to pull from Massachusetts and pull from Connecticut and New York, but we're already down 2 technicians in Massachusetts, which makes it a little challenging. So we're trying to replace those up there as well. We unfortunately, once we do hire somebody, there's a 6-week training program. We can't just put them on the street. So we're doing everything we can, including overtime and other resources, utilizing seating techs more than we have in the past, and production techs. We did see a slight spike in outstanding service orders and outstanding customers. Some of that is seasonality. We see a spike in the summer once schools get out and everybody wants to fix their kids' chairs and everything like that. So we do see a natural spike, but that coupled with the loss of a couple techs has caused us to be behind a little bit, and it's also dropped our compliance down to 91% for June. With bringing in extra resources, I'm hoping we can at least get back up to 95%. We do the best we can with getting their people to expedite things for us when we have an emergency. That's unfortunately, that part of the process is out of our control.
I know when I order my parts through Golden, it usually takes between 2 to 3 days to get my parts, or usually up to 5 days. Never goes that long. Is there anything on your end that you guys can do? Do you guys, does New Motion continue to call, check, and how often do you do that? And is that reflected in your data? Because I haven't seen the data. I don't have anything. I just got appointed like 2 seconds ago.
Well, the data doesn't include that because that's not part of what has to be measured in the process. The time waiting for the part to come in is not part of the calculation. That was written into the bill where that is omitted, but we measure it internally just because we are putting pressure on the major manufacturers. One, we want them to start stocking parts in distribution centers instead of us waiting for them to manufacture and ship the parts to us on a regular time frame. And, I think if they can open regional distribution centers, that would help a lot of things. But yes, to answer your question, we do meet with them regularly about it, and we do everything we can to pressure them about it.
Thank you so much.
You're very welcome.
And just for the new folks, Diane also reports the same issues with the manufacturers. This has been an ongoing it's been a while that you've been reporting issues with the manufacturers.
Yeah, it got really bad during COVID. It got a little better after the electronics started to flow through, because the biggest thing we had a problem with were like joysticks and control modules and motors that were coming mostly from China. And so we had a lot of problem with things sitting on a container ship out in the Los Angeles harbor because they couldn't unload it, things like that. So that's gotten better. It's just, there are just a couple manufacturers and a couple specific types of parts that we're still having a hard time getting in a reasonable time frame. And we got it down to about 10 days on the average. And now it's about 14 days.
All right. Thank you. Sheldon.
All right, thanks, Gary. Just a couple questions. One is, you said before that sometimes you borrow techs. Is that like from the neighboring states, like Massachusetts?
Yeah, so we've even flown techs in to various locations from other parts of the country if we need to, but that gets obviously very expensive. And you know, labor laws, we have to pay them overtime even on their travel time. So we try to be very careful with that because it gets very expensive. But yes, we bought, you know, Sheldon, we've been using a tech out of New York on a regular basis in Connecticut to try and get us more capacity. And we've also brought them from New Jersey and Pennsylvania. So we will continue to do that.
And Massachusetts and Rhode Island as well, I mean, because they're neighboring.
Yeah, we don't have techs in Rhode Island because we don't have a location in Rhode Island, but yes, Massachusetts. But again, we're down 2 technicians in Massachusetts, and we're in the same conversations in Massachusetts as we are in Connecticut with the disability coalitions about timeliness of service. And Massachusetts has gone a different route. They provided some incentive for us as far as timeliness in serving, completing service, and you know, we're pretty compliant with that. But again, we're down 2 technicians there, so it's tough to move resources around that you don't have.
I just want to thank you for the answer. I do want to point out that for people, especially who are new, one of the proposals that was discussed, it was not in the final report for this last year. But one of the proposals was to look at incentives, and we got a negative response from you guys. So I don't know. I mean, you just indicated it was a good thing in Massachusetts, but you don't think it's a good thing in Connecticut.
Well,
so
I don't think we were against incentives. I think there were some other things tied to it that we may have been. It wasn't equal to what was going on in Massachusetts and how it was presented. So I'm happy to talk to you about that offline, but my understanding of the incentives as they were offered was it was not the same type of situation. So, but
bottom line is you are supportive of what they're doing in Massachusetts. Just so
yes, I am.
All right. So my other question about staff is that, you know, it's a recurring thing that, and not just you, but Diane as well, that, you know, you lose staff, or sometimes you have to let them go, or sometimes they're in the probationary period and they just don't work out. That happens. Both of you report that a lot. As you said, if you lose 2, since you only have 8, that's a quarter of your. So I'm just wondering why you have, given that, no offense, but you know, 95%, which you say you want to go back up to, is still not compliant. Why would you not hire more people? Why would you not have more people? Then you'd have a little bit more flexibility than what you have right now.
We have had an evergreen requisition for the last year and a half, meaning we've had an opening always posted, and I am willing to hire 1 or 2 extra to go over what we need, because we will plan for attrition, but we can't even get to that level. It's been so tough to hire and get quality people when Amazon or Google or other companies are paying, you know, higher than we are, and for an easier job than what this job is. And so it's not like we have unlimited dollars, and we do pay pretty well for the role, and our reimbursement is capped. So I don't get any more for doing a repair, regardless of what I pay the technician. Whereas other companies can change their pricing. Our reimbursement is fixed, and that's why we've been looking and favoring incentives. We've been looking and favoring things for travel time, payment for travel time. We've been favoring things that allow us to make this more, economically feasible, to keep more technicians and to get more efficient. But yes, we have tried to hire more technicians. It's not like we stopped it when we had 8 technicians or full-time technicians, or when our capacity number was at 9.1. We still had an opening.
Right. Well, it's just my view of this is that if you acknowledge you're not paying as much as Amazon for jobs that, frankly, those jobs are easier, you're going to have to increase your rates. It sounds like. That's for me.
I think I've answered that.
Thanks, Jenny.
Yep.
Sorry, Jenny Hesley.
All right.
Bye, Jenny.
Bye, Jenny.
I think I've answered that. That there are certain economics to this. So
if we have to talk about the economics, we're happy to bring in all the profits that your company's making. But anyway, I appreciate your answer.
I'm not going to get into that again.
I know that, but you're using it. You're saying you don't have the money because there's just So maybe we should look at the profits.
Sheldon, I can rattle off when you want any number of investments we've made to be better at this from a technology and a people standpoint. And I'm not gonna defend my staffing model right now. But thank you.
We'll obviously as a council we're hearing what you're saying and we'll think about it. One last question. This is not, admittedly, this is not in your report, but it's new and relevant, and that is that the new law that was passed this year, which is 2672, there are 2 sections, and in section 15 is the section that requires in 3 different circumstances that the authorized wheelchair dealers notify consumers about the basics in the law passed 2 years ago. And I think this was effective July 1st, so I wanted to ask what New Motion has done about that in terms of notifying at the time of purchase, in any mailings, and on its website about.
We are working on complying with that. Our intent is to comply with that. I believe we have worked out the notification at the delivery of the new piece of equipment, which is one of the items on there. I believe the problem we were running into is our website is a national website, and it's a little more difficult to target things to certain states. So I believe that we've made the change to go ahead and put the notification when somebody goes into the Connecticut part of our site. I need to verify that, but I did talk to some people yesterday that was in the works, and we fully are willing to comply when it comes to any mailings. We've just got to figure out how to do that just for one state. Okay.
Thank you. Since it hasn't been finalized yet, I just wanted to ask if you'd be willing. I guess I did this in a previous meeting, but now that it's live, if you'd be willing to work with OHA on the language. Well, not just the language, but also readability, font size, and that kind of thing. Because they had offered a while ago, several times, to help with that, right, Becky? I don't want to put words in your mouth, but I'm pretty sure you did offer to help. And that might be instead of running it by the advocates, which of course we'd be happy to help with that. But if you don't want to do that, to run it by OHA, who's already offered a state agency, maybe that'd be a good way to approach it.
I would be happy to work with Becky and her team to do that.
It's same, Gary. You have the open door anytime.
Thank you.
Willing to work with you for sure.
Right.
Just be clear. It's our goal to comply, and we have no problem complying.
Okay, thanks. I want to note that after Todd's hand, Suzanne's asking to.
Oh no, Suzanne had her hand up first. Sorry.
Oh, okay, sorry.
Yeah. Yeah.
Thank you, Maureen and Sheldon. Gary, I know you're not my representative. I'm National Seating Mobility normally. But I have a question for everyone here. We have a law, a wheelchair law, and when we get our parts here, we have to sign paperwork saying we received it. Why can't you hand out the law with the paperwork so people can know the law?
We're doing that. That's what we've committed to doing. That there's another piece of paper added to the delivery packet that shows that notifies you of that opportunity. Is that not what you're asking me?
I'm asking. Yeah, I guess I'm asking you.
I'm
Go
sorry.
ahead. Go ahead.
Gary, is that at the time of the delivery of the wheelchair or for a repair? Because I don't know. Suzanne, are you talking about a repair or a new chair?
My understanding
I'm
was
talking about
it was,
preparing the chair.
Okay.
I mean, I don't think we have a problem doing it in either way. I think the bill states for delivery of a new chair, but it doesn't matter either way. You know, we can include it in the delivery packet.
Can I ask one more question?
Absolutely.
Of course.
Do we have the numbers of how many people you gave it to?
I don't know. I could probably find out. But it's just, we were just required as of July 1, and we're behind in getting it out. So I don't know how many we've actually given it to. I know that probably before the end of July, we will be 100% compliant.
All right, I was just wondering if we can have a copy of the numbers that you gave it to.
I'm happy to try and research and find out how many we did. It's, like I said, it's a matter of us adding it to every delivery paper, every delivery packet in Connecticut. So I can get that number at the end of the month for you.
Thank you very much.
Thank you.
And Gary, how often does your newsletter go out? Or do you just send it as needed? We get newsletters from you guys. I just in our email. But those are national.
I don't think there's a set time. I think it's early at best. So they will add it to that.
Okay. Yeah. Okay. Todd, go ahead.
Thanks for all this information, Gary. This has been great. A few years back, I believe New Motion acquired Spin Life. Do you know that? Right.
Yes.
Now, when ordering parts through Spin Life, you get them like within a week. So you own them. Couldn't you work out a way of getting parts quicker through them?
That's it. Look, I guarantee you those parts that Spin Life got for you, I could get in a week. Okay, it all depends on the part and the manufacturer. Spin Life is a totally separate entity from New Motion. Even though we own them, I don't control anything at Spin Life. Spin Life controls nothing that I do. But the purchasing from manufacturers should be no different. You know, it doesn't. You know, we don't sign checks for Spin Life. Spin Life has their own, whole organization. But I can assure you that if Spin Life can get something for you in 5 days, I can probably get it in 5 days.
Okay. And I was wondering, I know that you report a bunch of data to us. Is there a way to find out, like, these parts are next day? This, like you mentioned, the rear assist wheel from Germany is 6 months. It would be good for us to have an understanding that we could communicate out to our workforce or community to let them know, hey, listen, this is a major issue. You're probably going to be a few months out. Or, hey, thank God it's only tires, because we could have those tomorrow and they just got to get more people hired to get somebody out here. You know, I just think that could help you and help the community who might be like, where is everything? Why is this taking so long?
I think to some extent we could do that. It's just tough with all the various parts and all the various manufacturers to report every single delay.
So how are they managing, Gary? If they need new wheels and they're 6 to 8 months out, then what recourse? I mean, are they just stuck for that period of time?
Well, we've been able to find demo units and everything that we can, but unfortunately there are some people that are kind of out of luck, and We provided loaner chairs where we can, and we do our best. But I can't fabricate it out of midair. Doesn't
Yeah,
exist.
is that affecting anyone in Connecticut? That you know of?
Not that I'm aware of.
Your numbers
I'm
don't
sure,
look like it would be.
No, I'm sure I would have heard about it.
Okay. Yeah, right. Hopefully.
Yeah, right. I'm sure OHA would have had a complaint. So.
Yeah.
Other questions?
Gary, I just raised my hand late here, but I know you said you had to leave at 2, but just a quick question. I think I understand this right. If somebody has the main chair, right, and they have a backup chair, the main chair is the one that gets repaired, right? They don't have rights to get the second pair repaired, or it's just they could pay on their own, or they could get pieces repaired on that they want to pay and keep that chair maintained, but it's not something that insurance will pay for, or Medicaid or Medicare. Is that correct? Or
that is correct. Specifically Medicaid and Medicare, they only will pay for the primary chair. They only pay for repairs on the primary chair. And, unfortunately, it's an out-of-pocket situation beyond that.
all right, that's what I thought. Thank you for confirming.
Oh, and really quickly, Gary, so I had a repair last week. First of all, I was talking to, I know it's a call center. They had no idea when I was talking about the Connecticut law. They didn't know what that was, and that made me concerned, because if someone who doesn't know about the law, they might, there might be some confusion there. I always have a few issues going on at once. So the battery issue, that's under warranty, it's not a problem. But I have a hole in my tire. And so, first of all, they did not connect me to the remote tech, which that makes the most sense to me that you would do that, because you could see the hole.
Right.
And I got a little resistance from the call center person, and he said, no, you're going to have to wait on hold forever. Like, no, I don't want to connect you, but he did. But what I was told was if I came into the shop that I could get that tire replaced same day, but if they come out to my home, they have to do an evaluation, and they can't bring the tire with them. And
that's not true.
Yeah, it just didn't sound right. And so I just want to... I wanted to make sure that's not your policy.
That is not the policy.
Okay.
That is not what that's supposed to be, and I will look into that. And they should be, part of us complying with the bill is to, to have our people know about the bill and what the responsibilities are. So again, it's going to be a little bumpy in the first few weeks here. So, we just have to get everybody trained and everybody up to speed.
Okay. All right. Well, thank you for staying on.
Thank you.
Yeah.
Talk to you next month.
Thanks for answering my question.
You're very welcome. Thank you, Susan. Bye-bye.
Safe travels. Okay, so our group keeps getting smaller. All right, so
Sheldon has his hand up.
Sheldon, thank you.
Thanks. It's a little late, but thanks, Todd. I was going to follow up, because my understanding is in Massachusetts, Medicaid actually does pay for backup.
Yes.
So I wanted to ask him about that, but
I have a bunch of questions, but
Okay.
maybe that's a better discussion when both Gary and Diane are there.
yes, yeah.
And also, I'm very curious what their take is on the incentive program in Massachusetts, and I think Diane was the one who resisted more when we brought that up last year about putting that on the recommendations. I think she was more of a staunch objector than Gary. So I'm just curious. It would be worthwhile to have that conversation, I think.
Sheldon, what did you think? What did you think about my question, Sheldon?
That's a great question.
Yeah.
Great, and the answer was great. We'll see. I think that it would be good to have that conversation about the various things that are different. When Ginny's here as well, both have Ginny here.
Yes.
She hears from the Connecticut side and hear what they're saying about Massachusetts, because maybe there are reasons that we should incorporate certain good things from Massachusetts, and that there isn't a reason to resist. Maybe.
And we also, on our list of non-legislative recommendations, there was we had suggested to go back to DSS to Medicaid and have some more discussions specifically about the COLA, increasing COLA, and see if not increasing it, but having an adjustment. Yeah. So I think that's worthwhile, either next month or in September, because I'm sounding the alarm. After this meeting, we have 3 months before we're going to be working on the recommendations and annual report. So even though it's summer, the time is marching on.
But one last thing, I missed the first couple of minutes. Did Diane say she couldn't make it because of the change of time?
Yeah. Is that correct, Alex? That it was, she just, yeah.
She did not give a reason.
Oh, okay. She told us that the time change wasn't working for her, but yeah.
So that means she's gonna do that every meeting, or she just
No. Maureen,
okay.
Remember to raise your hand.
I'm sorry.
That's all right. It's all right. Okay, so we do have a few minutes left, and I think it was last meeting, we talked about the wheelchair user bill of rights, and Farah sent an email. Farah had talked about maybe recruiting some people so we can ensure that we would have a diverse group outside of this council. And Farah, so if you don't mind, I'll turn it over to you, and you can let us know about you could just let us know what you've done and what you're thinking, and we'll take it from there.
Sure. Thank you, Maureen. So we, as the council as a whole, when this was first brought up, had discussed the concept of putting together a wheelchair users bill of rights. It's wonderful. We had a very small subcommittee put together, which is not very diverse or representative of wheelchair users broadly, and we had talked about wanting to bring in other voices and perspectives and opinions, so that as we're putting together something that might be submitted as either a legislative or non-legislative proposal, or even just used by other folks, attorneys, lawmakers, etc. down the road, something to be gestured at. We want to make sure that it's the best and most representative piece that we can. So that was wholeheartedly supported, even bringing folks in for a one-off or for a more ongoing subcommittee. I've been chatting with folks in my circles, and there are quite a few wheelchair users that are very interested in being able to share their thoughts, opinions, and perspectives in whatever way the council deems is appropriate, ranging from folks who have never done anything like this before but have used chairs their whole lives and had issues, to people who do work like this on the reg, who work in advocacy, who work in academia, who work at the Capitol. So we have a whole range of folks, and I had emailed just asking what the steps are, what the thoughts are, since as a group we had talked about the importance of that broader viewpoint. So I guess that's that.
Yeah, thank you for taking that initiative. We back a few months ago, I'd mentioned the group that I represent, Citizens Coalition for Equal Access. They have done a separate Bill of Rights for medical use, and so they're seasoned, and maybe I'm thinking they're very tapped out because this group has worked really hard, but maybe we can collaborate with them, or even just look at what this group has accomplished. And it's really I'm part of this group, but anyway, Maryann, you have your hand up. Go ahead.
Okay. So, Farah, that sounds really, really interesting. like first and foremost, like I would like to say that, you know, diversity is very, very important. If you can include me in those emails that you're doing for outreach, I would really, really appreciate it. I used to be the executive director of Padres Abriendo Puerta in Greater Hartford, and we offer services to the Black and Latino community there. And, you know, perspectives are very, very important. But what are the rules in having outside voices to do the Bill of Rights? Can we do that? Can we do a subcommittee with people who are not on the council? I'm asking what the rules are.
So now that might be a John, but I don't know what the rules are, or if we don't have bylaws as a group. We don't have bylaws. And I don't know, so I don't know if there are any barriers, but I'm going to hand that over to my co-chair.
Yeah, no, I don't believe that there are. We can go back and look at the legislation that created this group. But no, we didn't, and we didn't create bylaws around that specifically when we convened. So I think everything is relatively silent on that. That being said, Sheldon, you got your hand up. I'm guessing you have some answers.
Yes.
I don't have an answer, but my understanding is the same as yours, John. And I will say this: I have been on things where there's the official thing, and then there's like we need a work group or subgroup, and the subgroup did include people who were interested. And I guess my overall view of this is, as long as there's not decision-making power, right, is that this group of people, whoever they are, and of course I completely agree with both Kara and Maryann on the importance of diversity, as long as it's a suggestion, here's our product, this is what we put together, happy to defend it, happy to answer questions, whatever, and then it goes to the council to then adjudicate in one way or another, accept, reject, modify. I don't see why that would be a problem to get broad input that way.
I agree, and both Farah and I are represented. As you all know, we have the Wheelchair Coalition, and we talk about this meeting and we take their input, and a lot of our questions are fielded from that group. So we're doing this already on some level, maybe not as officially, but we are doing it. So I agree. And just no decision-making power. And then, I guess whoever wants to be involved with that is great. I think that's great. Becky?
Well, I was going to say, too, I know when we originally brought that topic up, it was because it was one of the legislative proposals, right? And we were talking about a non-legislative proposal. And I remember calling out every single person in this group and naming you all by name individually, who are the people here before, saying the more people, the better, right? Because we need the most representation. I know, Farah, we talked about, too, having work groups or side groups or even a discussion team or bringing it to people. I think that's so important. So I think we're all on the same page as far as that's concerned. And the more voices, the more people who have experience, the more people who have family members who have experience, or any input that can benefit the wheelchair Bill of Rights for users, I think is huge. So I'm on board with that for sure. And I agree. I think that, having insight and input is valuable and important, but obviously the group as a whole will be the ones that kind of solidify everything in the end. But that experience and that background and that information is solid and necessary and so beneficial. And without it, we'd be lost and we'd be at a disservice not to entertain that idea.
Thank you, Becky. Suzanne, I do see your hand up, but Maryann had her hand up first.
I just want to add to Farah. So, if you can include me in those conversations, I would really appreciate it. And then also, if you could send me a link to the Independent Living Council meetings, that'd be great, so that I could get more like a custom of like what your role is and how you're representing them and how you're bringing all this information onto that council and what they're doing with it. I definitely want to just learn more. So if you could do that, that'd be great. My emails are, I guess you guys said for the Microsoft Teams, we're all together. I'm not sure.
You wouldn't be on that because you just got appointed. But I can share. Share your email.
Thank you so much.
Suzanne.
I have one concern. Not putting Debbie Downer here. If we join these groups and get them all together to decide how we do things, all right? We also have to watch out for two things. Everybody has a disability, yes. Everybody has an opinion, yes. But we don't know what's going to happen after they leave the groups. I don't know if I'm saying it right, but what I'm saying is, if I go in this group and say, well, I think we should do this, that, and the other thing, and then everybody says yes in the beginning, and then when you walk out the door, everybody says no. How do you know what they're doing? Am I making sense?
I'm not understanding your question or your.
Well, I think Suzanne, what Sheldon said is that, people can give us, their opinions or their concerns, but this group makes the final decisions because that's just like a working group.
Okay, I didn't hear that, sorry. Okay. Then I agree.
We want something that's to represent
everybody.
Wheelchair users, and I would hope that includes people with speech limitations because that is a huge barrier with medical appointments and wheelchair repairs if you can't communicate with your technician, and then also people who need to transfer out of with Hoyer or Sarah lifts or any type of lift situation. That is always a huge issue when it comes to wheelchair repairs. So it aids like people who need their PCA to be present during a repair. So those are that we definitely need to think about. Yep. That type of diversity in addition to racial LGBT, that kind of diversity. So we do need to think of all the diversities. Okay,
yeah, go ahead. I'm thinking of like language barrier, which it would also.
Oh yeah, absolutely.
Do not, communicate. Like how many texts, are Spanish speaking? How many texts know ASL? So those kinds of things are important.
Yeah, absolutely. Go ahead, Becky.
I was just thinking too, we also have to be conscientious. It's almost like the Medicare Bill of Rights, right? Where the providers have rights and also the users, right? So there's a respect issue in there. So we have to, I think, be cognizant to include both. And I think that would be, and we could also get the provider buy-in as well. So I think having both sides of it and having that accessible where the providers could go and say, here's your Bill of Rights, almost like when you go to a PPT meeting or something like that, or an IEP meeting with your children. You have, this is the school right, this is the user rights, this is the provider rights, and the respectfulness of it both ways. So looking at the diversity, but also looking at it from the overarching perspective. And I think looking at the Medicare Bill of Rights would be a good way to start out and kind of using that as a guide.
Yes, maybe we hope that maybe Gary and or Diane will be interested in helping out with that. And just a quick time check before I go to Maryann. We have 10 minutes, so just a time check. Go ahead, Maryann.
And I just, want to follow up on what Becky said, when it comes to new motion and national seating and mobility, what does effective communication, look like on their end? What do they consider effective communication? What do they consider, what it is to them and how they feel they're using it, and if it's effective, and if there have been any concerns about people who haven't been able to communicate, are they being hung up, are they not being understood, are there complaints like that? It's really important.
Thank you. Michelle.
I'm actually not familiar with the Medicare Bill of Rights, but I would be a little wary of that. I mean, and there's another title for a different kind of document, which is Medicare, or I shouldn't say Medicare, Consumers' Rights and Responsibilities. That's sometimes a title which is sort of reflects the two-way thing. But I kind of feel like it's important to have this come from the perspective of the consumers' needs. I mean, they're the ones who are having the problem. And so I have to look at the Medicare one, but I would like to try to suggest that we come from the focus of the consumers.
Yeah, that's a good point. Both point. I see both sides. Like, but yeah, I definitely. I mean, this is a wheelchair user bill of rights, so the input from the industry is good, but I do think it needs to be focused on the consumer. Unless anyone has disagreement, and I think that we'll table this and talk about it again next month, and that hopefully by then everyone has their appointments and everything, and then we can, maybe make this a little more official. Yeah. Does anyone have any further comments, questions? Sheldon?
What?
Oh wait, no, Sheldon.
Sorry, there is one thing that's a little awkward to say, but we have to, I believe, reaffirm you as the co-chair.
Yeah, I was going to bring that up after.
Oh, okay, sorry.
After this discussion. Yeah.
Sorry.
And the only thing I was going to add is, how many more confirmations are you waiting on?
Gary, Diane, Joe, and Farah. 4. Is that right, Becky? I think it's 4.
4 appointments, yes.
Yeah.
Well, I still didn't get my paper or my email.
Yeah,
Okay.
we talked about
We,
that. Yeah.
we've received that. We will send that to you and to Todd as well.
Okay.
And Sheldon.
All right. Do we have any other questions or comments? Okay, so Sheldon, well, first of all, I didn't get into, I had it at the top of my little notebook, the things I needed to mention. First thing I wrote was minutes, and I didn't do the minutes. We don't have minutes from last month, so I did just want to let you know that, and that's correct. Like Becky, we did not, or Alex, we did not get the minutes from Brianne.
We had followed up with Brianne and she hadn't responded about that.
Yeah, so I assume that we're just gonna move forward, and and then as far as the wheelchair, oh my gosh, as far as the co-chair position, we will be voting. This also has a 2-year term, and so we're gonna open that for votes next month. And Maryann.
I just want to ask, who is Dana on the screen? Dana Nestor? Is that a person who's an appointee too, or part of CTN?
Hi, are you able to hear me?
Yeah. Yes, we can hear you.
I work for the Senate Democratic Caucus as a policy analyst, and I cover the Human Services Committee and their related task forces and advisory councils.
So sometimes we do have, thank you, Dana. We do have a couple of people who do jump on occasionally. Dana's one of them. David Seifel, you probably see that name pop up. Emily Kimbrello generally doesn't come, but she is on the emails. And there's Nina Holmes, I think. So you might see some names pop up, but that's who they are. And good, that's a good question. But I think that we are good. I think that's I think it's it. I'm like looking at my notes to make sure that I've gotten everything. If not, we can always get to it next month. Okay, so if there's nothing else, I'll take a motion to adjourn. Our next meeting is the 19th of August at 11 a.m. And we're going to be back to that time.
Sounds terrific.
Thank you.
I'll make a motion to adjourn.
Okay, thank you. Second?
Second.
Okay. All right, all in favor?
Aye.
Aye. All right. Thank you so much, everyone, and thanks for rolling with the punches with us. And we'll be, I think we'll be in a much better shape next month. So thank you so much. Enjoy July, the rest of July. We'll see you.
Thanks, Maureen. Great job.
Welcome, everybody. Thank you.